Hey there, and welcome to our video on testosterone supplements for men. In this video, we'll be diving deep into the world of testosterone boosters, exploring their potential benefits, risks, and alternatives. We'll also discuss lifestyle factors that can influence your testosterone levels and when testosterone replacement therapy might be necessary. By the end of this video, you'll have a comprehensive understanding of testosterone supplements and be better equipped to make informed decisions about your health. So let's get started. Testosterone, the primary male sex hormone, plays a crucial role in maintaining typical masculine characteristics like muscle mass, facial and body hair, libido, and sperm production. As men age, their testosterone levels naturally decline by about 1 to 2% per year after the age of 30 or 40, according to a study by Lopresti and colleagues published in the American Journal of Men's Health in 2019. This gradual decrease can lead to symptoms such as fatigue, depression, low libido, erectile dysfunction, and reduced muscle mass. To combat these symptoms and maintain healthy testosterone levels, many men turn to testosterone supplements, also known as boosters. These products often contain vitamins, minerals, and herbs that claim to increase testosterone levels in the body. However, a review by Clemesher and colleagues, published in the World Journal of Men's Health in 2020, found that there is limited research on the effectiveness and safety of these supplements. It's crucial to understand the potential benefits, risks, and alternatives associated with testosterone supplements before incorporating them into your health regimen. Let's take a closer look at some of the common ingredients found in testosterone boosters. D-Aspartic acid is a natural amino acid that plays a role in the synthesis and release of testosterone. A study by Topo and colleagues published in Reproductive Biology and Endocrinology in 2009 found that supplementing with D-aspartic acid for 90 days increased sperm count and testosterone levels in men with impaired sperm production. However, more research is needed to confirm these findings and determine the optimal dosage and duration of supplementation. Vitamin D deficiency has been linked to lower testosterone levels in men. A study by Pills and colleagues published in Hormone and Metabolic Research in 2011 found that overweight men who took 3,332 IU of vitamin D daily for a year experienced a significant increase in testosterone levels compared to those who took a placebo. While this study suggests that vitamin D supplementation may be beneficial for men with low testosterone, more research is needed to establish the optimal dosage and determine the long-term effects. Zinc is an essential mineral that plays a crucial role in testosterone production. Low zinc levels have been associated with hypogonadism, or clinically low testosterone, according to a study by Prasad and colleagues published in Nutrition in 1996. A small study by Brilla and Conte, published in the Journal of Exercise Physiology Online in 2000, found that supplementing with a combination of zinc, magnesium, and vitamin B6 increased testosterone levels in college football players. However, the study had a small sample size and did not control for other factors that could influence testosterone levels. Ashwagandha, an herb commonly used in Ayurvedic medicine, has shown promise in boosting testosterone levels. A randomized, double-blind, placebo-controlled study by Lopresti and colleagues, published in the American Journal of Men's Health in 2019, found that taking 600 milligrams of ashwagandha extract daily for 8 weeks significantly increased testosterone levels in overweight men aged 40 to 70. While these results are promising, more research is needed to confirm the testosterone-boosting effects of ashwagandha and determine the optimal dosage and duration of supplementation. Fenugreek, another herb, has been shown to inhibit the enzymes that convert testosterone to estrogen. A study by Maheshwari and colleagues, published in the International Journal of Medical Sciences in 2017, found that taking 600 milligrams of fenugreek extract daily for 12 weeks increased testosterone levels and improved sexual function in healthy adult males. However, the study had a small sample size and did not include a placebo control group. Despite the popularity of testosterone boosters, there is limited evidence to support their effectiveness and long-term safety. The review by Clemesher and colleagues found that only 24.8% of the 50 testosterone booster supplements they evaluated had data to support their claims. Additionally, some of these supplements contained excessive doses of vitamins and minerals that could potentially pose health risks. It's essential to be aware of the potential side effects of testosterone boosters, which can include acne, male pattern baldness, mood swings, and aggression. These supplements may also suppress the body's natural testosterone production and lower sperm count. Before starting any testosterone booster regimen, it's crucial to consult with a healthcare professional to discuss the potential risks and benefits. While testosterone boosters may seem like a quick fix for low testosterone, making healthy lifestyle changes is often a safer and more effective approach. Several lifestyle factors have been shown to influence testosterone levels, including obesity and diet, sleep, stress, and alcohol consumption. Obesity and diets high in ultra-processed foods have been linked to lower testosterone levels in men, according to a study by Fantas and colleagues published in the Journal of Urology in 2022. Maintaining a healthy weight through a balanced diet rich in whole foods, such as fruits, vegetables, lean proteins, and healthy fats, may help support optimal testosterone levels. Lack of sleep has been associated with decreased testosterone levels, so ensuring that you get 7 to 9 hours of quality sleep each night can help maintain healthy testosterone levels and overall well-being. Chronic stress can lead to elevated levels of cortisol, a hormone that can suppress testosterone production. Engaging in stress-reducing activities such as exercise, meditation, and deep breathing may help support healthy testosterone levels. Heavy alcohol consumption has been linked to lower testosterone levels and reduced sperm quality. Limiting alcohol intake or avoiding it altogether may help maintain optimal testosterone levels. For men who have been diagnosed with hypogonadism or clinically low testosterone, testosterone replacement therapy, TRT, may be prescribed by a healthcare professional. TRT involves the administration of testosterone through injections, gels, or patches to bring testosterone levels back into the normal range. While TRT can be effective in treating the symptoms of low testosterone, it also comes with potential risks and side effects. These include sleep apnea, acne, enlarged prostate, and an increased risk of blood clots and cardiovascular events, as noted in a study by Bassin and colleagues published in the Journal of Clinical Endocrinology and Metabolism in 2018. It's crucial for men to work closely with their healthcare provider to monitor their testosterone levels and overall health while undergoing TRT. Before starting any testosterone supplement or therapy, it's essential for men to consult with a qualified healthcare professional. Low testosterone can be a symptom of underlying health conditions, such as obesity, type 2 diabetes, or pituitary disorders, which require proper diagnosis and treatment, according to the study by Bassin and colleagues. A healthcare provider can order blood tests to measure testosterone levels and determine if a man has hypogonadism. They can also discuss the potential benefits and risks of testosterone supplements and therapy, as well as recommend lifestyle changes that may help support healthy testosterone levels. It's important to note that testosterone supplements and therapy are not appropriate for all men. For example, men with prostate cancer or breast cancer should not take testosterone, as it may worsen their condition, according to the study by Bassin and colleagues. Additionally, men who are trying to conceive should avoid testosterone therapy, as it can suppress sperm production and fertility. While some studies have shown promising results for certain ingredients in testosterone boosters, such as D-Aspartic acid, vitamin D, and ashwagandha, more research is needed to confirm their effectiveness and safety. Many of the existing studies have small sample sizes, short durations, and lack placebo control groups, making it difficult to draw definitive conclusions. Furthermore, there is a lack of research on the long-term effects of testosterone boosters and their potential interactions with medications and other supplements. As the popularity of these products continues to grow, it's crucial for researchers to conduct well-designed, large-scale clinical trials to better understand their impact on male health. While testosterone supplements and therapy may offer potential benefits for some men, it's essential to approach testosterone health from a holistic perspective. This means addressing not only the symptoms of low testosterone, but also the underlying lifestyle and health factors that may be contributing to the problem. By making healthy lifestyle choices, such as maintaining a balanced diet, getting regular exercise, managing stress, and prioritizing sleep, men can support their overall health and well-being, which may, in turn, help maintain optimal testosterone levels. Additionally, regular checkups with a healthcare provider can help identify and address any underlying health issues that may be impacting testosterone production. It's also important for men to be cautious of marketing claims surrounding testosterone boosters and to prioritize evidence-based information when making decisions about their health. While the promise of a quick fix may be appealing, the reality is that there is no substitute for a healthy lifestyle and proper medical care when it comes to maintaining optimal testosterone levels and overall well-being. In conclusion, while testosterone supplements and boosters may seem like an attractive solution for men experiencing symptoms of low testosterone, the evidence supporting their effectiveness and safety is limited. Many of these products contain vitamins, minerals, and herbs that have shown potential for increasing testosterone levels in small studies, but more research is needed to confirm these findings and determine the optimal dosages and durations of supplementation. It's crucial for men to be aware of the potential risks and side effects associated with testosterone boosters, such as acne, male pattern baldness, mood swings, and suppression of natural testosterone production. Before starting any testosterone supplement regimen, men should consult with a qualified healthcare professional to discuss their individual needs and potential risks. Adopting a healthy lifestyle is often a safer and more effective approach to supporting optimal testosterone levels. Maintaining a healthy weight, getting regular exercise, managing stress, prioritizing sleep, and limiting alcohol consumption have all been shown to positively influence testosterone levels. By taking a holistic approach to health and well-being, men can support their body's natural testosterone production and overall vitality. For men diagnosed with hypogonadism, testosterone replacement therapy may be prescribed by a healthcare provider. However, this treatment also comes with potential risks and side effects, and it's essential for men to work closely with their healthcare provider to monitor their testosterone levels and overall health while undergoing therapy. Ultimately, more research is needed to fully understand the impact of testosterone supplements and boosters on male health. As the popularity of these products continues to grow, it's crucial for men to prioritize evidence-based information and consult with healthcare professionals when making decisions about their health. By taking a cautious and informed approach to testosterone health, men can work towards maintaining optimal hormone levels and overall well-being. If you're looking for high-quality supplements to support your health and well-being, be sure to visit nutritionmarket.com.au. At Nutrition Market, we offer a wide range of supplements, including those that may help support healthy testosterone levels. We also have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to discuss your individual needs and goals. Remember, while supplements can be a helpful addition to a healthy lifestyle, they should not be considered a replacement for a balanced diet, regular exercise, and proper medical care. Always consult with a healthcare professional before starting any new supplement regimen. If you found this video informative and helpful, please hit the like button and subscribe to our channel for more content on health and wellness. And remember, the information provided in this video is for educational purposes only and should not be considered medical advice. Consult with a qualified healthcare professional before making any changes to your health regimen. Thanks for watching, and we'll see you in the next video.